Hi, my name is Dr. Caxnopera. This morning I'm going to be sharing a little bit with you about how divorce doubles the risk of death from cardiovascular diseases. There are 30 million divorces in the United States alone, and this factor, called the divorce factor, is an important marker of death disability. It increases the risk of a stroke and heart attack, as well as breast cancer. This morning I want to look at a couple of studies. One of them is called the British Regional Heart Study. In this particular study, 7,735 men between the ages of 40 and 59, between 1978 and 1980, from general medical practices in 24 towns in England, Wales, and Scotland, were chosen randomly and followed for 11 and a half years. What that study showed was that divorced men had a cardiovascular disease mortality about 1.9 times. That is, death from cardiovascular disease was about 1.9 times higher, almost double, that of the married selected counterparts, men. And that non-cardiovascular deaths, again, this is the British Regional Heart Study done in the United Kingdom, non-cardiovascular deaths 4 times more likely than that for married men. This study can be found in the American Journal of Epidemiology and in 1995, October 15 issue. Next, I want to share a little bit with you about the National Longitudinal Mortality Study. You probably heard me talk about that particular study. 530,000 plus men and women between the ages of 25 and above were recruited over a 6-year period and followed from 1979 through that time through 1989. Of this, about 281,460 men and women between the ages of 45 and older were then studied further. What did they find? Their findings were published in the Journal of Epidemiology and Community Health in April 2000. Divorced men were twice more likely in this study to commit suicide. Let's go on to Japan. In the Japanese collaborative cohort study, after adjusting for age, divorced people had double the likelihood of developing coronary heart disease. Let's move on to Sweden. The importance of this is that you need to see that overall, when a person is divorced, their risk for death, for strokes, for heart attacks invariably doubles. And we cannot ignore this health concern. In Sweden, they also published a report and a study in the American Journal of Epidemiology, 1989, showing that overall death rate was double, 20% in divorced men compared with 9% for married men. Now let's look at Japan, France, and Hungary. And I'm going to take them in this order: France, Japan, and Hungary, where Dr. Hu and Dr. Noreen Goldman published interesting findings in the 1990 May 27 issue of Demography. Here they found that in France, death rates for divorced men were 1.85 times higher than that for married men. In Japan, death rates for divorced men were 1.55 times higher than for married men. That's in Japan. And in Hungary, death rates for divorced men were 1.67 times higher for divorced men when compared to married men. Now, the real issue, heart attacks, cardiovascular disease, coronary artery disease is increased in incidence in divorced people. The question is, if divorce doubles the risk of a heart attack, is there anything in the current literature, in medicine, any curriculum in medical schools, any curriculum for continuing medical education that addresses the risk of a divorced person having a heart attack? Or what are they doing to modify that risk? I gave some recommendations in How Divorce Kills, my book, and I'm currently working on another book, Guidelines for the Divorced Patient. But to understand the gravity of the deficiency in addressing this higher risk of heart disease in divorcees, I want you to look at the NIH risk calculator. It's a 10-year heart attack risk calculator. It can be found at http://CVD risk, and you can Google that, and I'm sure you'll come up with the rest of the link, so you can plug in some numbers. And what that cardiovascular risk calculator does is to enable you to plug in your age, whether or not you smoke, your sex, whether male or female, your cholesterol, total cholesterol, your HDL cholesterol, which is a good cholesterol, your systolic blood pressure, the upper one, the higher one, and whether or not you're on medications for the blood pressure. Using those, there are several illustrations I'm going to give you. Here, first is a patient called Bob. Bob is 45 years old, smokes, he's got high cholesterol. His blood pressure is 120/80. We're going to only use the top one for the NIH, but he's got a blood pressure 120/80, total cholesterol 200, and HDL 30. What's his 10-year risk of a heart attack? It's 13%. Now, let's take Brad, a non-smoker with high cholesterol, same cholesterol level, blood pressure is 120/80, cholesterol 200, HDL 30. His 10-year risk of a heart attack is only 4%. Now, what about Bill? Let's use Bill with a higher blood pressure and a smoker. Bill, 45 years old, smokes, has high cholesterol. His blood pressure is 150/80. He's on blood pressure medicines. His total cholesterol is 200 and his HDL is still 30, like the others. What's Bill's 10-year risk of a heart attack? 21%. Wow. Now, notice carefully. 10-year risk of a heart attack in a 45-year-old smoker with high blood pressure that's poorly controlled, high cholesterol, 21%. Unbelievable. Now, do you know what the risk, if we go just by the British Regional Heart Study alone, an 11.5-year risk of a heart attack is double after a divorce. Divorce cannot be neglected as a risk factor for death and heart attacks, because invariably death from cardiovascular disease is almost doubled based on the British Regional Heart Study. And there's several more. So what I want to say here is divorce is not just a social epidemiologic marker. It is a risk factor to be reckoned with. And combined, divorce alone is a far more potent risk factor for heart attacks and cardiovascular death than smoking, hypertension, high cholesterol, poorly controlled blood pressure, all combined. So we must do something. And I'm hoping that as we continue this lecture series on video, you will see some of the things that are planned. Thank you for listening. Dr. Gaxner Perry.